Hi, I'm Helene Hubbard, and I'm a registered nurse for 29 years. I graduated from Dominican College in 1993 with my Bachelor of Science in Nursing, and have been working as a nurse ever since. I had my first position in skilled nursing and did that for 2 years as a registered nurse in relief charge. From there, I worked in a major medical trauma center on a medical floor and was ACLS and tele certified, and did that for another year. And upon returning to California, there was not many opportunities and decided to try something new. And in 1996, I took my position as a home health nurse. And there was definitely some challenges with that. There's definitely an ick factor with the wounds and with the homes in some of the cases, and also getting lost. Don't like to get lost. Anyhow, that's much improved with GPS now. I decided that I just needed something more. I needed more of a challenge. And in 97, decided that maybe in the future, nursing administration might be something that I'd like to do. So having an MBA would be a good degree to have. And being a nurse, had no business classes, so enrolled at Chico State and had to take all the prerequisites. 30 units later, decided that I did not want an MBA and kept working in my home health position and transitioned to case management. Had a caseload of 40 to 60 patients and kept working, and still wanted something more. Was accepted into California State University Chico's program for the Master of Science in Nursing, and completed all the coursework for that. And that was, I started that in 1999, and did all the coursework, but later wasn't able to complete the thesis within the 5 years. Anyhow, with that, my boss, with my level of education, started giving me more responsibilities. She started having me doing quality assurance risk management. She started having me do ride-alongs with the fellow staff. And then I had an opportunity to do quality assurance risk management for a clinic system, and accepted that position and left and did that for a year. And decided that when my second daughter was born, that I just didn't want to do that anymore, that it was too many hours and too much for my family life, and really enjoyed home health more. And so when I went back to work, I went back to work per diem as a visiting nurse in home health. At that time, I became wound care certified, and also started transitioning to working more hours in home health, and doing case management. And the hospital at that time did not have a wound care team, so I was doing wound care consults also for like 2 to 5 patients a day, making recommendations for wound care for them also, and educating the staff, both nursing and doctors, about wound management there. And so from there, I've transitioned back to field nursing, and thankfully the hospital has a wound care team, so I can just concentrate on seeing home health patients. And now working towards getting my nurse practitioner. And my experience with evidence-based practice is limited to pretty much reading research and applying it to my practice and evaluating that. Most recently, reading an article about lower extremity edema and daily skin hygiene and twice daily application of an emollient to prevent skin ulceration, and that's B-level evidence. And I've been sharing that with staff, fellow nurses, and patients, and I'm getting good response from the patients that way. Areas of advanced practice interested in research for the capstone project. For me, that is barriers to adherence. One of the areas that I'd be interested in that is barriers to adherence with nutrition and management of disease, like with heart failure and edema, or with diabetes. And the other area would be with barriers to adherence with edema management, with compression therapy, elevation of the lower extremities, and just as we were talking about skin hygiene and application of an emollient, it's amazing how scaly legs can be. Excuse me. My personal goals for the class are to improve my skills at discerning the rigor of research and applying it to practice for approved outcomes, and also to be able to put together a good capstone project. And then personally, I've been married for 26 years. We have got two daughters, and we love to travel and hike. All right, I'm looking forward to a great semester, and look forward to getting to know all of you. You guys have a great evening.